All right, so we're going to go ahead and do a central line dressing change and a blood draw for Ivy, our patient today. So I'm going to go ahead and walk in the room and I'm going to gel in, as always. And I'll introduce myself. So, hi Ivy, my name is Carmiel. I'm your nurse for today. We have a couple procedures we're going to be doing right now. If this is an okay time for you, we're going to go ahead and do a central dressing line change as well as take a blood draw from that area as well. Can I have you state your name and date of birth, please? Perfect. All right, looks good. So we're going to go ahead and provide privacy, and we're going to go ahead and do this. If I can ask you, do you have any allergies to shellfish or any other known drug allergies? Oops. You do not? All right, good to hear. Toss this back in. All right, well, I'm going to go ahead and just get station prepped for me and get all my materials. So I'll go ahead and raise you up to an appropriate working height so I don't hurt my back. And we'll get at this, okay? All right, so we're gonna get you sit up, and then since we're doing a central dressing line change, I brought a mask in for you. We just don't want you breathing in that area, and that's why I'm also wearing a mask. So I'm gonna have you go ahead and wear that. And then we're gonna go ahead and get started. Let me get my materials. So this is a used kit, but obviously for you, we're using a brand new one. And we're just gonna open this up, and we'll toss that. But I'll reuse this possibly, so I'm gonna keep that there. And then I'm gonna go ahead and begin by just peeling off the outer edge of your dressing, okay? So I'm gonna hold this down, making sure that we don't move that. And just to make it easier on myself, when I have my sterile gloves on, and this is a sterile procedure, that's one of the reasons I have you wearing that mask. Are you hurting at all with this? No? It's coming off nicely? Perfect. How's the day been going for you so far? Not too hot? What's been going on? Okay, that sounds like something we can manage, I think. You just been chilling watching TV? Has therapy come in yet? Alright, good to hear. Well, that's some progress compared to what I've been reading about what you've been doing, so. Alright. We're nice and sticky on you. That's a good thing, because that means that this isn't going anywhere. You're not hurting at all while we're doing this? It's all good? Perfect. Alrighty. That's okay, that's coming off anyways. Alrighty, Ivy, so we're almost ready. Perfect. And that's nice and prepped. So now I'm going to go ahead and get my sterile gloves on, and we'll go ahead and get that off and get that changed. So I'm going to go ahead and gel again. Got to dry to dye. And I'm going to open up my sterile field. So I'm just going to move this here. It won't be over. And then everything in this container is sterile, as well as the tegaderm. So I'm going to go ahead and open that up and pop that onto my sterile field. Away from
you might keep them on in real life, like depending on, but if they're really done. But yeah, you can put on.
I'll just set that off to the side, and then I'm going to go ahead and grab the outer packaging of my gloves. And then typically the bed would be raised, so it might be okay for me to do this here, but I'm going to squat down for the safety of my back. Or the bed is raised technically, but we're using that. And just touching that outer inch, holding this on the outside so it doesn't fold back. And then we're going to go ahead and pinch. And scoop. Making sure only touch the inner cuff with the sterile part of the glove. We'll pull that down. Perfect. Alrighty. So we're almost ready to get you changed. Let me go ahead and just get my materials set out and around with what we need. So we have our iodine sticks. We have our chlorhexidine patch. And then I have a pen in my pocket, which we'll also need. So I'm going to go ahead and remove this.
And then Larry, can you tell me your last name and date of birth? Yeah. And do you have any allergies that I should know about?
Touching the underside only. Up there. Perfect. Alright. That's all set. We're not going to cross over the sterile field, so we'll toss this. I should have a trash set up to myself. Right over there. Trash is over there though. And then we're going to go ahead and clean you up first, okay? So we're going to go ahead and get our iodine swabs. And I already asked you if you're allergic to shellfish, and you said no. Sometimes we have chlorhexidine. Do you know if you have an allergy to that? No as well. Perfect. All right. We're going to go ahead and get this nice and wet. And then we're going to do 30 seconds of cleaning, starting from the cleanest area, which should be the inside, scrubbing our way to the outside. Good. Scrubbing our way down the line. Perfect. And then we'll go ahead and let that dry. Tossing that in the trash as well. 30 seconds later, it's nice and dry, so we're going to go ahead and grab our little chlorhexidine disc and we'll attach it there. Perfect. And now we're going to go ahead and get our Tegaderm. So we will peel this back. And then we're going to go ahead and try to center it right there.
How are you feeling today, Larry?
And then we'll put some nice tension to try to keep it as stiff down as possible. And we'll go ahead and place that all around. So now that this is down, we no longer need to be sterile because there's no access to this. So these gloves are no longer sterile, but we're going to go ahead and peel off. Oops. And as we peel, just going to press down that outer edge, making sure we have a nice barrier around. Oops. All right, we'll start on that back side. Let's continue here, actually. This might be tricky with my gloves. Oh boy. All right. Let's see if we get up around here. Still doing all right there, Ivy? What would do here? All right. Go up over your shoulder, pressing down the entire way. Keep your mask on, but well, we don't need it on anymore. But you're all covered up. Perfect. All right, so that's now nice and packed. Now we're going to go ahead and do our label. So we're done with our sterility right now. We're going to go and put this away. I'm going to put it up here because I'd reuse it. I might reuse it, but typically that would just go in the trash. We have our initials, date, and the time. And this is the hardest part of the procedure, Ivy, is peeling this very thin sticker off the sticky piece of paper. But we got it. And so now we'll know when we need to change it again. Alrighty, so that's all set. Perfect, so we have that done. If you'd like to remove your mask, you can. You would. Alright, perfect. So we'll go ahead and toss that. And now we're going to go ahead and do a blood draw. So, I'm going to go ahead and get my materials for that. Clean this all up. And then we're still just clean, we're not sterile, so I don't need to change my gloves. So we're going to go ahead and be doing a blood draw now. While we're doing this, if you're experiencing any pain, as always, please let me know, and we'll go ahead and stop and figure out what's causing that pain. So we're going to go ahead and start off by opening up this cap. And I did forget another Kuros cap, so we're going to reuse this one, but typically I'd have some on a stethoscope and I would pop one of those on. And just for safety measures, since we're accessing a central line, we're going to go ahead and just scrub that hub. But those Kuros caps should be good. So doing this for 10 to 15 seconds, 30 seconds depending on policy, and then keeping this away from everything. So now we're going to go ahead and check for blood return, as well as do a little flushing to make sure it's patent. Removing any air, we're good there. And we'll attach, unclip, and then we're going to go ahead and pulsatile push in about 5 milliliters, and it's feeling good. So then we're going to pull back, and you won't be able to see it, but typically we get some nice blood coming back. And it's still good, so we're going to go ahead and do a pulse down motion all the way through, flushing the full 10 milliliters. Alright. Everything's good there. Perfect. Alright, so now we're going to go ahead and do a draw. So we can disconnect this one. We'll toss that, but I reuse these. be drawing 6 milliliters because we need 3 milliliters for a CBC and 3 for basic chemistry. And we can't see it, but that is some nice deep red blood. And we've let a bit of time go by since we've done our flush just to make sure that we don't have a lot of saline in the blood. We're gonna go just over 6, just to make sure we have enough now to reaccess it. And then we're gonna go ahead and disconnect that, set that off to the side. And we'll go ahead and finish off with one more flush. We'll go ahead and push this in, still pulsing, but we know it's patent, it's all good. And then we're gonna go ahead and saline lock it. Perfect. Alrighty. So then I'd have a brand new Cures cap, pop that off right here, stick that back on, and we're all set there. Now we're gonna go ahead and get our blood into our vials, and we know that lavender is last, so we'll go ahead and attach right in here. And then I have 7 milliliters of blood, so I'm gonna go ahead and do 4 in the first. Or no, 3, because we only need 3 per. And we're in. Pressure is still. There we go. And there's a line right here that I can look for. Alright, so we're at the 4 milliliters, so we know we're in. We have 3 milliliters in there. And then we're going to go ahead and do lavender last. Put that in there. And then there's a line that we want to reach on the lavender one. Alrighty. Perfect, so we got that set up now too. Alright, there's a bit of blood in here, so I would go ahead and dispose of this in the biohazard.
I'll put it back for you.
And then we're going to go ahead and label these tubes with the patient's name, when the blood was drawn, and bring these down to labs. And then I'll clean up my station. And then IV. So we're all done for right now. Is there anything else that I can get? Is there anything else I can get you before I head out? You're all set. Good to hear. All right, so we're gonna go ahead and get you lowered down. Bed is locked and low. Clean this up, and I'm gonna reuse this again. And then I want to make sure you have your call light, which is right here. That's all set. All right, if there's anything else that you need, please let me know. I will go ahead and remove my gloves. I'm gonna reuse these though. I will do hand hygiene. I'll be bringing the vials down with me, and then I will document. That was the pressure. I will document what I did. And typically, if these are brand new, they would not be exploding like that. So yeah. All right.